do first is we're going to take our calipers. For the upper, you want to make sure that these little red measuring devices are rotated towards the outside. For the lower, you'll want to rotate these around and make sure that they're rotated towards the inside. So what we'll do is, since we're going to make an upper tray, we'll go ahead and we'll want these to line up along the distal-most 3 teeth in each arch. And this portion right here can actually rest on the occlusal surfaces of the teeth. So go ahead and measure Raina here. And we'll try and maintain that position. And Clinician's Choice has a very nice measuring guide for us to use. So we'll line this up against each of these and we'll notice that Raina is almost an exact size 43 lower tray. Just for instructional purposes, we'll go ahead and rotate this around and we'll measure the lower arch just to see what size tray she would be for the lower arch. Once again, line it up against the lingual of the 3 most posterior teeth. Transfer it accordingly. Measure it up against there. And she's actually in between a 52 and a 53. But since we're adjusting these trays, we'll actually utilize a size 53 if we were to take a lower impression. Since we're doing upper today, what we'll do is we'll take the trays, and you'll notice that on the distal portion, on the undersurface, that they're numbered. This one here says number 43, and we'll immerse that into our warm water for 1 minute, and at that point in time, we'll start adjusting it accordingly. So our minute's up. We'll notice once we take the trays out, they're rather pliable, and Raina's exostoses are on the buccal portion of her posterior teeth. So what I'm going to do is I'm just going to lightly spread this tray out, just using light finger pressure around the buccal portion. And then once I'm convinced that it's in our desired position, I'm going to hold it there for about 5 seconds. Once we've held it there for about 5 seconds, I'll air dry it. I'll just fan it and make sure it's cooler to the touch. And then we'll try it in. We'll make sure it feels comfortable. Does that feel comfortable? And at that point in time, we've accomplished our goals. We've got a tray that's going to be customizable to Raina. We'll go ahead and paint this tray, and then we'll take an impression of Raina's teeth, and we'll have made a perfect impression with a customizable tray. Thank you very much.